Hi, my name's Eric, and in this presentation, I'll be sharing my final project, which focuses on improving surgical outcomes by applying Peplow's interpersonal relations theory to full surgical experience. My clinical question is, what are the contributing factors to patient dissatisfaction with surgical, preoperative, intraoperative, and postoperative PACU care in the perioperative population? Basically, what I'm really asking is, how can nurses use therapeutic communication to improve outcomes for surgical patients from pre-op through recovery? So here's my initial concept map, which highlights the core factors driving patient dissatisfaction across the surgical experience. Things like communication issues, unmet expectations, and systemic challenges. This clinical question matters because perioperative patients are especially vulnerable. They move quickly through different phases of care and interact with multiple teams. Nurses, and especially advanced practice nurses, are often in a unique position to provide consistency, education, and emotional support through the entire surgical process. Our ability to communicate clearly and compassionately can make a difference in how patients perceive and experience their care. Okay, so this is Hildegard Peplau, a huge figure in nursing history. Among other things, during her lifetime, she served in World War II, and she also became the first nurse since Florence Nightingale to publish a formal theory. That theory was interpersonal relations in nursing and was published in 1952. It completely reframed nursing as a therapeutic relationship-based process, not just task completion. She is known as the mother of psychiatric nursing, but her theory applies far beyond psych. It outlines four phases of the nurse-patient relationship. Firstly, the orientation phase is where the trust is built. Then the nurse helps define the patient's needs in the identification stage. Next, the exploitation phase is where the patient uses resources like the nurse and support for healing. And the relationship concludes with resolution, where the patient regains independence and the relationship kind of winds down. These stages align really well with the surgical process, starting with pre-op education and ending in recovery. That's why I chose her theory for this project. Here's a visualization of her theory, the four phases of the nurse-patient relationship we just talked about. Now, here's my take on it, tailored specifically for the surgical setting. In the orientation phase, we begin by building trust early, setting clear expectations, involving the family, and providing timely, open communication. This helps reduce delays, anxiety, and uncertainty before the procedure even starts. For the intraoperative phase, I combine Peplau's identification and exploitation stages, since the patient is usually sedated and time is limited. Even then, we advocate further dignity, update the family to maintain trust, and ensure continuity into recovery. Then, in the recovery and discharge phase, I merged Peplow's exploitation and resolution phases, because this is when we're coaching the patient, offering reassurance, and helping them transition out of acute care. We use the teach-back method, provide comfort and PACU, and include families in discharge planning, helping patients feel confident as they head home. Basically, at the core of this model is trust. When patients feel supported, they're more likely to have a positive mindset, and that mindset improves recovery. So as nurses, we have the most direct and consistent contact with surgical patients, and that gives us a powerful opportunity to shape their experience and improve results. By applying this theory-informed model, we can expect meaningful outcomes, higher patient satisfaction and trust, better post-op compliance, stronger family involvement, and fewer complications or readmissions. When we take the time to explain, reassure, and advocate, we're not just checking boxes, we're shaping the patient's entire experience. Mindset impacts surgical recovery, and as nurses, we're the ones consistently at the bedside. That gives us both the opportunity and the responsibility to support healing on every level. So here's my final takeaway. Be intentional with your communication. Even small interactions matter. The way we show up, listen, and educate truly shapes how patients heal. That wraps it up for me. Thanks for watching and have a great day.